Hi all. Today we'll discuss the Absolute Eosinophil Count, or AEC, a simple but clinically valuable blood test that helps identify conditions associated with eosinophilia. Eosinophils are a type of white blood cell that play a role in the body's immune response, especially against parasitic infections and in allergic reactions. They also contribute to inflammatory responses in certain autoimmune and respiratory diseases. The absolute eosinophil count represents the actual number of eosinophils in 1 microliter of blood. It's calculated by multiplying the total white blood cell count by the percentage of eosinophils seen on a differential leukocyte count. For example, if the total WBC count is 8,000 per microliter and eosinophils make up 5%, the AEC would be 400 cells per microliter. The normal range for AEC is typically less than 500 cells per microliter. When it exceeds this, the condition is termed eosinophilia. The severity is often graded as mild, 500 to 1500 cells per microliter, moderate, 1500 to 5000, severe, above 5000. Let's look at some causes of eosinophilia. The most common causes include allergic disorders, such as bronchial asthma, allergic rhinitis, and atopic dermatitis. Parasitic infections, particularly those involving tissue migration, like filariasis, ascariasis, or hookworm infection, are also frequent causes, especially in tropical regions. Other causes include drug reactions, autoimmune conditions such as eosinophilic granulomatosis with polyangiitis, certain connective tissue diseases, and malignancies like Hodgkin lymphoma or some leukemias. In some cases, a very high or persistent eosinophil count may indicate hypereosinophilic syndrome, a rare condition where eosinophils cause tissue damage in organs, such as the heart, lungs, and nervous system. It's important to interpret the AEC in clinical context. A mild transient rise might follow a recent allergic episode, while sustained eosinophilia warrants a detailed search for underlying infection or systemic disease. For investigation, you should also correlate AEC with peripheral smear findings, stool examination for parasites, and allergy history. To summarize, AEC quantifies eosinophils per microliter of blood. Normal value is below 500. Anything above suggests eosinophilia. Common causes include allergies, parasitic infections, drug reactions, and some systemic diseases. Always interpret results in conjunction with symptoms and other lab findings. A well-interpreted AEC can guide diagnosis and management, helping distinguish benign allergic causes from serious systemic disorders. Thank you.